I feel like everyone knows the term perimenopause now, but a lot of patients go, am I in perimenopause? But I don't know what it is.
Yeah.
So I would say perimenopause is that time where you're still having a period, but maybe it's become a little bit different in some way.
Welcome to the Late Aesthetics Show, the space where wellness meets wisdom and we uncover what it really takes to look and feel amazing from the inside out. My guest today is a total powerhouse. Dr. Sohe is a GP turned hormone specialist and integrative medicine doctor who helps women take back control of their health, hormones and happiness. From her clinics in London and Harley Street, she works with women struggling with fatigue, mood swings, perimenopause and everything in between, helping them reclaim energy and balance using both medical science and holistic tools. So today we're talking about bioidentical hormones, burnout, beauty, and why fixing your hormones might just fix your life. So let's get into it. Thank you so much for joining me today.
Thanks for having me.
So you were a conventional GP for years. What made you step into the world of integrative and hormone-focused medicine?
Well, I found as a conventional doctor that I was not really treating my patients in the same way I'd want to treat myself.
Yeah.
So it was very much about prescriptions and, oh, there's nothing on your blood, so there's nothing I can do to help you. And I felt quite limited, really. I've also got a background in psychiatry.
Okay.
So I kind of knew that, mental health plays a huge part in your physical health as well. And then I learned about more integrative medicine, and that's looking at the root cause, also looking at, the best of Western medicine, but also complementary or alternative therapies. And then I heard about hormones. It was actually from a coach of mine who's like, I've been to this amazing hormone clinic. And then when I learned about hormones, I'm like, that is the missing piece of the puzzle.
Yeah.
And then just everything made sense to me. And then because I could see such a big impact for the patients I was treating, it just made sense for me to go with that more.
Oh, fantastic. And when patients come to you and they say, it's probably quite common, I don't feel right, something's different. What are the patterns that you begin to uncover that are beneath, obviously, that sentence or behind that sentence, so to speak?
Yeah, so I ask quite a lot of questions because not everyone's always that in tune with what's going on with themselves. And sometimes you need someone to prompt you to kind of help. So if you say, look, I just don't feel right, be like, well, what does that mean to you? Is it your mood? Is it your energy? Is it your sleep? Is it your focus? Are you feeling different in your body? Is it just, I'd say confidence in your abilities, or is it confidence in your body?
Yeah.
And all those things play a part in the way we feel. So I help people to sort of uncover what exactly they mean.
And maybe sometimes it's a mixture of different things.
Definitely.
It's not just one thing.
Oh yeah, most of the time it is, yeah.
Okay, fantastic. And I believe that you are definitely a doctor who listens to their patients. So quite often as a standard GP, you only get 6 or 7 minutes per patient. But I can imagine you're one of those doctors who really takes their time with their patients. And that's quite rare. That doesn't happen across the board. But how do you approach consultations and making sure that you're listening to the patient and, the patient feels understood?
Yeah, I try my best, and obviously it's really hard when you're a conventional GP and you've got such a short space of time and you've got a backlog of people waiting to come in and see you as well. So I really do empathise there with GPs and the limitations they have. But for me, I think it's really important to hear what the person's saying. And sometimes I ask questions. So if they've said something, I go, oh, I think this is what you said. And sometimes I'm wrong and that's not what they meant. So I'm just double checking, getting to what they really want to tell me. So I think that's really important. And the other thing is, I do testing, and testing is really important, I feel. But so is the way the person feels. Yeah. So I think it's always going back to that, because sometimes after I've treated someone, they might go, well, I don't feel any better. But I'm like, but your levels are better. But then that doesn't mean they need to just leave.
Yeah, exactly.
I'm like, well, okay, there must be something else going on. And sort of my approach is kind of physical, of course. But, it's very much mind, body, soul, because all these things play a part in the way we feel. So I think it's important to look at all those different perspectives when I'm treating someone as well.
And also, if someone says that they don't feel any better, quite often they've maybe forgotten about how they used to feel.
Yeah.
So how they feel now has just become the norm. They've they've forgotten what they were like 6 months ago, because we're with ourselves every day. So it can be easy to forget that. Definitely.
I like to go back to the first consultation notes and be like, right, you said you were feeling this, 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 and this, and they're like, oh yeah, actually those things are better. So I'm like, okay, so then what's going on now?
Yes.
Because maybe all those things are better, but something else is going on.
Yes.
And then we can look at that as well.
So it might be a case of changing the treatment plan to, because you've maybe fixed something, and then it's kind of a case of there's something different that they want to work on.
And like often people come to see me about hormones, right? And then it might be, but your hormone levels are better. So we've addressed that, but now maybe something else is going on.
Yeah.
So we need to look at what else could be going on that means you don't feel right.
Exactly. Well, let's really dive into hormones, because obviously they play such a vital role in the human body. But are there any signs that, let's say, somebody in their 30s or 40s should look for in case something is off, so to speak?
So I'd say a really good place to start is tracking your cycle. And that doesn't just mean, when I'm on my period, when I'm not on my period. It means, although it could be that, maybe it's got irregular or something's changed. But it's like, how do you feel around it? And like, I got into this work about 12 or 14 years ago. And before that, I wasn't tracking my cycle at all. And I had no idea the impact it was having on my mood and my energy and my sleep and my focus and just the way I felt about myself.
Okay.
And then obviously when I started doing this work, it's my job. So I do track those things. And I'm like, oh my gosh, I had all those years when I had no idea that hormones were playing such a big part in the way I felt. So the first thing I'd say is start tracking the way you feel. And it's so easy these days with all the apps available that you could do pen and paper. You could just put notes in your phone. And it really is about going, well, what's going on with my sleep, my mood, my energy? And sometimes, people don't feel like going to the gym on certain days, and other days they do feel like it. And they're like, oh, I'm just lazy. Maybe it's hormonal. Maybe some days you eat better and other days you're just binging or like got more cravings. It could be hormonal. I'm not saying everything's hormonal, but at least start tracking and seeing if there's any patterns to what's going on for you. That's
a really, really good bit of advice, because you're right. Sometimes, especially as women, one day you might just crave carbs, for example. And that's like literally that's the only thing that you want. You don't want anything else. That's all you want. But I think, as women, we definitely need to be on top of that for sure. And you must come across perimenopause as a word quite often in your practice. How do you actually explain that to patients? That word is thrown around all the time, but how do you actually explain what perimenopause is?
Yeah, I mean, I feel like everyone knows the term perimenopause now, but a lot of patients go, am I in perimenopause? But I don't know what it is. So I feel like we kind of know the term, but we don't really, not everyone really understands exactly what it is and what to do about it, more importantly. So I would say perimenopause is that time where you're still having a period, but maybe it's become a little bit different in some way. So maybe your cycle has got shorter. Maybe you were like a 28-day cycle. Maybe now it's like 26 or 24 days. And maybe the bleed has changed in some way. So people often say, oh, I always bleed for 5 days, but now it's got a bit longer or it's got a bit shorter. And also the way you feel around your bleed might have changed as well in terms of your mood and your energy and your sleep and all those sort of things that we've already mentioned.
And again, that's something you can track as well.
Definitely, yeah.
So you specialise in bioidentical hormone therapy. How does that differ from HRT, and who is that typically best suited for?
Sure. So HRT just stands for hormone replacement therapy, and it covers the whole umbrella of different types of hormones you can take. So I work with bio and body identical hormones. So both of those are hormones that have the same chemical structure as the hormones your body is making or was making previously if you've stopped having your period. And when you take bio or body identical hormones, it means that your body can metabolize them better because they've got the same chemical structure as what you were making. Some HRT are basically drugs with hormonal properties. They're a bit more synthetic, whereas these are more chemically matched to your body. Bioidentical hormones are often compounded by a pharmacy, so they're custom made into certain doses and forms. And body identical hormones are now quite widely available. You can sometimes get them even from your NHS GP. And they're things like estrogen gels or patches and progesterone tablets, micronized progesterone tablets like Utrogestan. And, well, it's a bit more tricky with getting testosterone always, but yeah, so sometimes that does need to be custom made or has to be a specialist prescription. But yeah, basically your body can metabolize them better. So I feel that people have better results with them, and also they have other benefits for the body as well.
Okay, fantastic. But will it differ from patient to patient who benefits the most from either option?
So when I see a patient, I give them a range of choices because like I believe both can be effective. So I'm going to give the patient all the options and then they can make decisions about what they feel is best for their body. Some people just want something custom made for them and that's their choice. But I think there's absolutely nothing wrong with the estrogen gels that are available or the patches or the progesterone tablets. And I prescribe a lot of them as well. However, sometimes people have issues with those. And then it's good to give them another option, going, well, we could try a different form or a different dose. So I just feel like I'm giving people more options for what's available.
And is it normal to, let's say, try one thing and, for example, that might not be best for you, and then there's a different option where you can try, obviously, something different?
Definitely, yeah.
Fantastic. And how quickly can you expect to see benefits? How quickly can you expect to feel the benefits? And how long do those benefits last?
So, well, they would last, I guess, as long as you're taking things. But I'd say if you're having a cycle and you're using different hormones around your cycle, I normally say to my patients, let's give it 3 cycles and then I'll see you, because you should notice a bit more improvement month on month on month.
Okay.
When my patients are coming in menopause, generally I say most people experience some improvement between 2 and 4 weeks. I do see patients who are like, I instantly felt better and that's great. I'd say between 2 and 4 weeks is realistic. And really maybe the full effect would be somewhere between 8 and 10 weeks. I normally follow them up around then.
Okay. And is this the type of thing that you do need to continue taking?
Well, I think it's patient preference. So some people feel like they take something for, say, 6 months and maybe, well, because the other thing is hormones are doing so much, right? But also if you're looking at your lifestyle and your habits and taking some supplements and changing other things, you're going to feel more benefit than if you're purely just relying on the hormones.
It's one element of what you can do. There's other things that are big contributing lifestyle factors, of course.
Exactly. So if someone's doing all those other changes as well, they might feel like, oh, I don't know if I want to carry on with the hormones. But the current guidance is if you start taking hormones around your perimenopause or menopause and you're feeling benefit, and I add the caveat, if you're being monitored, you can continue it long term. So it's nice that women now have that option, because before it was like you can take hormones till you're 55 or for 5 years and then you've got no options after that. So I just think it's great. People have different choices now.
Yeah, definitely. I didn't know that. So you could only take them for a period of time. And also, if you start taking the hormones during perimenopause, will that reduce the risk of, the severity, let's say, of certain symptoms when you actually hit the menopause?
Yeah, that's what I find. It's sort of managing all the symptoms in the perimenopause. And up until quite recently, I see a lot of patients in the perimenopause. I mean, I still do, but I used to see them because GPs wouldn't treat people until the periods had fully stopped. But now that's changed, because quite often it's more problematic before your periods stop than when your periods stop. So it's great that GPs are getting more informed on that as well.
Yeah, definitely. And that's just that continuous education at the end of the day. So we've touched upon hormones being one part of something that somebody can do in the perimenopause. There are other aspects that change, such as your mood changes, your energy levels change. And do you quite often see patients that struggle with low energy, changes in mood? And why is this such a modern epidemic?
Well, I think it's because we're all quite stressed out. So, and everyone's really busy and everyone's doing a lot. We're kind of sort of fed this sort of thing that you've got to be doing everything, or you get FOMO and you're not getting enough done. And I think stress is a huge contributing factor to health. And actually cortisol, one of the stress hormones, it can affect the efficacy of the hormones that some people are taking. So it really is important to be looking at what's going on with your stress and try and build healthy habits around that as well.
So you mentioned cortisol. Is there anything that you can do to lower cortisol levels in the body?
There is. There are certain supplements that can help with regulating your cortisol if it's too high or too low.
Okay.
Things like ashwagandha, B vitamins can help, vitamin C, magnesium, other adaptogens. So there are supplements that help. But I do always say to my patients, it is about lifestyle change. And I'm also realistic. I'm not saying, oh, go quit your job and leave your family and do all those things.
Go live on the beach or whatever.
Exactly. You know, it's just not realistic. Yeah. But it's about going, right, where can I carve out little bits of time for me? Where can I do something? I love this expression, net time, no extra time. So it's a bit like if you're in the car and you're driving, you know, could I listen to some nice relaxing music? Could I listen to a podcast I enjoy, or am I going to listen to the news?
Yeah.
And it's about what can you do that takes up no extra time, so you're not trying to cram more stuff in if you're a very busy person.
Yeah, I like that. That works really well. I mean, you know, in a dream scenario, it would be a beach because there's less worries on a beach, I often think. And then when I travel and whatnot, I'm like, oh, these. If you're living in a hot climate, for example, there's the beach. I'm just like, people seem a lot less stressed being in that environment. It's like quite often, like we laugh, like when we go to Spain, for example, they always have a siesta in the afternoon.
Yeah.
And it's kind of like we run at 100 miles an hour in the UK, but when you visit another country, they're like, no, I'll get to it when I get to it.
Yeah.
It's like, no, it's siesta time.
Yeah, exactly.
You know, whereas I think we do put a lot of pressure on ourselves.
Yeah.
Whether it's self-inflicted or societal, you know, there is pressure for sure. And I think, you know, you're a big advocate for treating the cause, not just the symptoms. So it's like just, you don't want to put a plaster over something. You want to get to the root cause of the problem. But what does that actually look like in your daily practice? Like, how can you get to the root cause of something?
So what I do when I see someone is, you know, I'm looking at lots of different factors. So quite often someone comes in with a concern, right? So something that's troubling them, that's affecting their quality of life or the way they feel. And I'm also thinking, well, what else could it be? So quite often people come in because they think, oh, maybe it's a gut health issue, or is it my thyroid, or is it my hormones? And it could be all of those things or a combination. Then it's also going, well, okay, what are you eating?
Yeah.
Because if you're really tired and you're sort of relying on lots of caffeine to keep you going, and you're drinking lots of alcohol in the evening, and you're having sugar and not getting enough protein or enough nutrients, you know, fruit and veg and things, that's going to be a huge factor. And I do understand, like, it's not always the first thing I address, because if someone comes in and they feel like they're running on empty, it's a bit like, I don't want to give them more things to do in a way. I always think, well, let's get you feeling a little bit better. So I saw a lady this morning, and like, she doesn't have a lot of energy to exercise at the moment, and she feels quite achy when she exercises. So she knows exercise is good, but her testosterone's super low. So I'm like, oh, it's a bit chicken and egg, isn't it? Because like, exercise helps your testosterone, but your testosterone's already low. So I'm like, let's try and optimize your testosterone, and then we can see if you can do a bit more. So it is about, I think, also helping someone and not being too hard on them. And quite often, you know, we're not stupid, right? We know we need to be making these changes, but for whatever reason, we feel like we can't make that change because too busy or too overwhelmed, or you feel you don't have time, or you just don't feel good. So I'm like, right, let me try and give you a bit of support around it, and then we can see where we can sort of bring in changes. And like, say if you're someone who doesn't exercise, I'm not going to be like, oh, go to the gym for an hour 5 times a week, right?
It's unrealistic. It's not going to happen. Exactly.
So I want to start with a bit of walking, or can you do like a little bit of online yoga at home, or something like that, and then build it up slowly.
Yeah, something that fits into your lifestyle. Like, for example, like me, I don't like going to the gym for like an hour. I find that so boring, and then kind of psychologically, you're not motivated to do that. Whereas if it was something that was 15, 20 minutes, it was effective. You know, at least then it's been done. You feel so great. But some people like going for 1 to 2 hours, and that's great. That fits into their whole lifestyle. But for me, not necessarily. And I have laughed before, so I've had like a PT in the past, and then, you know, a lot of PTs, they tell you that you need to do these check-ins, like on a weekly basis, and you need to do a food diary, and it's kind of like I live a busy lifestyle. I don't have the time to be writing everything down and then submitting it to you. It's kind of like the school teacher kind of thing. It doesn't, so that doesn't personally work for me.
Yeah.
But I know a lot of other people it works for, you know, very, very well.
And I think that's what it's about. It's about finding what works for you. So some people love tracking stuff, like you said. Other people, maybe it'd be easier for you to like take photos of what you're eating and send that in. So yeah, I think it's also about knowing yourself and what works. Because I always say to people, if I make a treatment plan, like, is this going to work for you? Or like, say if I'm giving someone supplements, I'm like, realistically, how many supplements do you think you're going to take? Because there's no point me giving you like 5 supplements or 8 supplements if you're just thinking in your head like, oh, I'm just going to say I'm going to take them, but then I'm not because I don't want to disappoint her. And I'm like, it's not about disappointing me, you know, I'm not your mum or your teacher. So it's about going, let's be realistic, let's be really honest with each other, and then I can work with what works for you.
Definitely, definitely. Is there a link between hormone imbalance and mental health that we're still not talking enough about?
Yeah, I think so. I think like you only have to look at people with PMS, premenstrual syndrome, and PMDD, which is the more severe form of PMS. And hormones definitely affect mood, and menstrual cycles affect mood, and even testosterone in men, if it's low, affects men's mental health. And I see men as well, and I think that's a really important aspect of men's mental health that isn't always looked at. And yeah, definitely affects mental health if your hormones aren't optimum.
So would it be a good sense then to start with like a test, like some blood test, see what's lacking, and then try and rebalance the hormones that way?
So I'd say hormones definitely do play a part, but it's not the only thing. So like what I want to do ideally when I see someone is check all the different things that could be affecting their health and their mental health. So it could be they're low on B vitamins or vitamin D, that massively affects mood. If their blood sugars are not optimum, that can affect your mental health, thyroid, other hormones, if you're getting anemic and have a low iron. So I think hormones are really important, but I think that's why I sort of differ. I like to look at the full picture and see what else could be going on.
Absolutely.
But equally, I'm not opposed if somebody does need to take an antidepressant, for instance. You know, we've got to do what works for the person in front of me.
Yeah, absolutely. There's so many different types of tests that you can get now. So can you explain what the different types of tests are, you know, what are available? Because there's things like the Dutch test, cortisol specific tests. What exactly are the different variations of tests, and where should somebody start?
It is tricky, and that's often why people come to see me, because they're a bit like, I want some sort of testing done, but I don't know what.
Exactly,
And I do blood testing sometimes. And if someone's having a cycle and I'm checking hormones, I normally do that in the latter part of their cycle, somewhere around day 21, because that gives me the most useful information. If I was going to do a Dutch test, I'd also do that around day 21. And the most common thing I hear from patients is, I saw someone else and they said testing's pointless because your hormones change all the time. And I'm a bit like, well, they're not changing every single minute of every single day, right? But they do follow a cyclical pattern. And for me, doing testing in that luteal phase is very useful because it's going to show me the biggest imbalance between your estrogen and progesterone. And that's not what a lot of doctors look at. They're like, well, you're making your hormones, but what is the balance of the hormones? That's really important. And that's often where you can get symptoms because the balance isn't quite right. Like maybe you've got too much estrogen, not enough progesterone, or sometimes I see people with too much progesterone and then need to help someone metabolize what's going on in their system and detoxify from the hormones as well. A Dutch test, because not everyone might know what that is, nothing to do with Netherlands, stands for Dried Urine Test for Complete Hormones. And you basically pee on these strips of card over a day, and it gives you information about your hormones, how you're metabolizing them, your cortisol stress hormone that you mentioned as well. And it gives you some organic acid markers. It gives you an indication for a few B vitamins and some neurotransmitters, what's going on with your gut health. So that can be quite useful. I mean, my ideal would have some bloods and to have a Dutch test
so
if it's possible.
So with the Dutch test, so you is that different times of the day then?
Yeah.
So it's as you said, your hormones, or some people, your hormones are changing all the time. So what's the point? But if you're doing that at different times of the day, it's going to give you different markers throughout the day, isn't it?
Yeah. So you do 2 in the morning and you do 2 in the evening and night. And essentially, it's also showing what your cortisol's doing.
Yeah.
So your cortisol follows the normal circadian rhythm, which is sort of like where our 9 to 5 work comes in.
Yeah.
So cortisol's high in the morning, should be low in the evening. So that's the benefit of doing the Dutch at different times of the day. It looks at what your cortisol's doing. I find it a really helpful test. I normally do mine once or twice a year.
Okay.
I do my bloods once or twice a year as well, because I also like to see what my sugars are doing and what else is going on with my micronutrients, make sure liver's doing all right with all the supplements I take and all those sort of things. So I think it is important to practice what you preach.
Definitely. And that's an at-home test that you can do.
It is,
well. Yeah. And where would someone be able to secure that test? By coming to you like directly?
Yeah, I think generally you need to go through a practitioner. I believe so. I might be wrong, but yeah.
Because even then, how else would you interpret the results?
Yeah, they're not easy to interpret yourself.
So you can do the test, but then obviously you need to be able to interpret the results of that test. And what about tests like biological age tests as well? Is that something that you offer? Do you believe in them?
Yeah, it is something I offer. And it can be quite useful to give you an idea. Well, my age is this, but what's actually going on, biological versus your chronological age. And then if you're doing different interventions, we can see if those things improve as well. I also do like urine tests that look for different vitamins and minerals. So I think that can be quite helpful to do sometimes, especially, if people are quite tired and they've maybe done other things, but they're not sure, well, what exactly is going on for me. So a lady I've been seeing, she wanted some IV vitamins, but she didn't just want any old thing. She kind of wanted to know what she was low on. So we kind of bespoke it for her.
Yeah.
And then in terms of gut health, there are stool tests you can do and other breath tests and things that look at what's going on with your biome and if there's any irregular bacteria and things like that as well.
Oh, fantastic. So let's move on to like mindset and manifestation, because that's a big part of your practice.
Yeah.
And it's one thing that kind of stands your work out. It's not just hormones. Let's test you. Let's fix that. It's a whole concept of looking at your lifestyle, as you've previously mentioned. But why does, mindset and manifestation matter so much when looking at the bigger picture?
So I think maybe because I did psychiatry quite early in my career, I just saw the importance of mental health for all health and how your mind has a huge impact on your physical body. And there's a whole study of that, psychoneuroimmunology, showing your thoughts and your mindset and, visualization and things like that can have an actual impact on your immune system and then how you feel. And I think I got into that really early, and then doing psychiatry, I did a bit of NLP as well and things like that. And where I did psychiatry on the Isle of Wight, they used to have acupuncture for patients. They'd have yoga, all these sort of things, just showing how that has a massive impact on mental health. So I got very, very interested in all those sort of things quite early on. And to be honest, it's the sort of thing I was really interested in say, my early 20s and things, sort of reading books about the law of attraction and mindset and Tony Robbins and all these sort of things. And I just saw how much it was benefiting me. And I think it's also very empowering to realize that we do have quite a lot of control over these things.
So you've said previously before that being happy and healthy is a decision that we can make. But how can someone start making that decision when they're exhausted, overwhelmed, lack of motivation? Where's the starting point?
Yeah, it's hard, isn't it? And I do know it is difficult. And, I've been in places in my life where, things can feel very difficult when you're trying to make changes. Mm-hmm. I would say, think about what you can do. Right? So if you make a list of all the different things you can do, and I try and break them, I call it my nourishment list, right? So different things I can do for my body, my mind, my soul. Sometimes it can be going out and seeing a friend, having a laugh with them, going out for a walk in nature, listening to music I enjoy. There's so many different things you can look at, and just pick one.
Yeah.
Just start with one to begin with and go, right, what can I do every day? I'm going to listen to some music in the car and sing really loudly, or I'm going to go for a walk because it's sunny and not be on my phone and just try and be really mindful, or I'm going to walk through the park today and look at the flowers. Just pick something you can do. Yeah. But like with the hormone work, and I was saying, sometimes I see people who are feeling at a very low ebb. And I'll go sometimes, okay, let's do nothing for now and just try and work on the hormones and getting you feeling a bit better physically and maybe taking some supplements, and then we'll see what else we can bring in.
Definitely. Is there anything that you personally do to stay grounded? Like, for example, meditation, breath work, allocating a certain time of the day just for yourself. Is there anything you personally do?
So I have a very busy mind, and I'm someone who's quite a high cortisol person. So I'm aware that I have to like do things to sort of ground myself quite a lot.
Yeah.
So like, especially when the weather's beautiful, when I'm not in London, I'm in Wales, and I like to go for a walk and go down to the beach, put my feet in the water and just ground myself that way. And that brings me a lot of joy. Spending time with family and friends is really important for me. Community,
Yeah.
I think that's really, really important. I journal. I try and do, even if it's just 10 minutes of some meditation or breath work or visualization. So I try and bring little things in. And then in the evening, I try and have a little ritual with like making a herbal tea as I'm winding down for bed and doing some self-care.
Okay.
So they're not always big things, but I try and bring like a couple of little things in at least every day.
That's really important. And you have to prioritize yourself. If you don't prioritize yourself, nobody's going to do that for you.
Yes, true. And then you're pouring from an empty cup, and then I can't give as much as I want to other people because I'm not looking after myself. But on the way over here, I was listening on my headphones to a bit of Boney M. I thought I'm going to listen to some cheerful music to like get me going. Yeah, exactly.
And do you know what? That's a really, really good point. So every time in the house, I have to have music on. I have to, sometimes, yes, you want quiet silence. I understand that. But typically in the morning, I think you need to get in the mood for the day.
Yeah.
So there's certain like music that you can listen to in the morning, whatever your favorite music is that really gets you going, and it sets you up for a really, really good start of the day.
I like to have a bit of balance of like music, and then sometimes if I'm in the car, I might just have silence. I can just sort of feel into what's going on for me at the moment. You know, is there anything going on? Do I need to address anything? You know, just sort of feel into what's happening. So sometimes we're so busy, we don't get a chance to actually feel what is going on for us.
Absolutely, absolutely. Let's talk about aging. In your experience, how does hormone balance influence the skin, confidence, and even the aging process?
So estrogen has a huge impact on collagen production, and then that is why often people can notice facial changes or skin changes as they're going through their perimenopause and menopause. Yeah. And then obviously that's just another thing that you then maybe don't feel so good about in yourself.
Absolutely.
So I do think that, you know, obviously I focus on what's going on the inside of the body, but what happens on the inside definitely has an impact on the outside as well.
Yeah, and it definitely reflects on the outside as well.
Yeah.
Are there any aesthetic or wellness treatments that you believe are most effective when combined with balancing hormones?
I do. I think that obviously it's not my specialist field. I'm not an injector, but I do know a lot of the treatments, injectable skin boosters and things can have huge benefit at that time as well. And I would also say that I think if you're looking at your hormones and getting them optimized, any other aesthetic treatments you have are probably going to be more effective as well.
Yeah.
So I think that combination's really nice.
Absolutely, I agree. What's one anti-aging myth or fear that you'd love to put to rest right now?
So I think first of all, the term anti-aging is, you know, not ideal really, because then it's just already creating a fear around aging and like what's next essentially. And you know, traditionally when a woman was ending her period, she would then go into her wise woman era, and she'd be sort of the center of the village and the source of all wisdom. And I think we've forgotten a lot of that as well, because we're so busy trying to like not age. And I'm not saying, I want to have great energy as I'm aging and, you know, still want to look as nice as I can and all those sort of things. And I think that's important. And I think you can have both. Yeah. I think that there's so much available these days in terms of hormones and all the other sort of things you can do with supplements and looking after yourself and wellness, and obviously, your appearance. Yeah. And so I think, the way you feel in your body is very important as well. But I think let's also remember that we're stepping into our wise woman era.
I love that's that. Quite nice. That's really, really nice. And I've often heard, for example, some injectors, they won't inject the smile lines because that's showing that you've laughed, you've had a good time. So they will refuse to do that area. So I think, the whole anti-aging thing, you're right. It's not about reversing the aging process, no Benjamin Button stuff, but it's kind of embracing the year and what you are at that present time. I think is really important.
Yeah, and aging well, I guess, right? That's what we all want. We want to be happy and healthy as we age.
Yeah.
And But I think, yeah, let's remember all the aspects of ourselves, right?
Yeah.
So the physical, the body, but also our mind, our soul, our spirit, and let's bring all of that into aging.
I agree. So let's round off with a quick fire round. So you just say the first thing that comes to mind when I say something. So estrogen or progesterone, what makes the biggest impact?
Ooh. So I'm not going to say one word, but I'd say in perimenopause, I think often progesterone.
Yeah.
I think in menopause, estrogen.
Okay. Fatigue cure, supplements, sleep, or stress relief?
Stress relief, I think.
One wellness book that you would recommend to everybody?
So this is quite an old book, but it had a profound impact on me a long time ago. It's called Be Your Own Life Coach by Fiona Harold, who was after I read the book, she became a personal mentor of mine, actually.
Wow.
And it's just very empowering about how you can sort of, all the things we've talked about, how you can just sort of like look at all aspects of your health and your life and sort of take control of it.
Fantastic. Is there a mindset habit that you swear by personally?
So I think affirmations can be quite useful, and the way you talk to yourself, I'd say more.
Yeah.
So I try and spend a bit of time in the morning just sort of feeling into what comes in for me and any affirmations for the day that I want to carry throughout my day. And then I do like to close my day by then reflecting on what's gone on, what could have gone better, not in a harsh, judgy way to myself, and then what I want for the next day as well.
Oh, fantastic. Yeah, it's always good when you're in bed to recap the day.
I think so.
And even in the morning as well, to know what you've got coming up that day. So, you're psychologically prepared. Exactly. So finally, if every woman listening today took one action to move toward hormonal balance and vitality, what would it be?
I would say start tracking what's going on for yourself, because I just believe people in general need to become the expert on themselves. So the more you understand your body, what's going on for you, your mind, your emotions, if you then go and seek help, you can be really firm, like, no, this is not normal for me, so we need to look at it.
I love that. That's definitely some good advice to take away from this podcast, definitely. Thank you so much for being a fantastic guest on the show. Your work is so empowering, it's practical, and it's really inspirational as well. So how can people get in contact with you if they'd like to reach out and find out more, or, come in and see you?
Sure, yeah. So I'm quite active on Instagram, Dr Sohe _hormones and health.
Love that.
My website is my name, drsoheroked.co.uk, and they can send me a message through there as well.
Thank you so much for being a fantastic guest. And as always, please make sure to comment, subscribe, and like.